to the 390 fund. And I know a lot of folks on this call are NWA members. Just as a reminder, I am always available to you if you have questions about those opportunities. Happy to chat with you. That's part of the reason why we're having this today, is we wanted to be able to bring together a group, talk through some of the great work that has been done in Montana, and sort of want to encourage folks to really try and utilize these grant opportunities as you are able, because it is a unique grant opportunity. It's non-competitive. We want to see as many folks as can apply for this. So just a little background on the WIC Technology Group. The National WIC Association and Nava, with support from Code for America, have formed this working group. It really is a collaboration where we are different groups working in the space of WIC and other public benefits and technology, and are able to share resources with, and just as a reminder, if you are not speaking, if you can mute yourself, thanks. So we have a collaboration so that we can create resources for you all, for our members, as well as share the work that is ongoing between our organizations. And it's been really great to work with Nava on a number of projects. And we've got some exciting work coming down the pike as well. So with that being said, I will turn it back over to LP to kind of walk us through the rest of the day or the afternoon.
Great, thanks, Christina. So our agenda for today, we've just started with our welcome. I'll turn it over to Kate in a moment to share her vision for WIC and how states can get involved. And then we'll spend the bulk of the time with open Q&A and state collaboration. So our goals for today, well, first, I'll just remind us of what Nava is. Nava is a public benefit corporation that believes that government services should be simple, effective, and accessible for all. We transform services, programs, and agencies that serve vulnerable populations, and have enjoyed working with Montana WIC on our demonstration project over the past couple months. And our goals today are for that you learn about Montana's ideas for applying for recent grant funding based on Montana's ongoing projects and upcoming projects, as well as learning how getting involved could benefit your program. And just to foster this state collaboration, and we are here also to help answer any questions you might have about human-centered design or technology projects that you might want to run in your own states or local areas. So now I will pass it over to Kate to share more about Montana's vision for WIC.
Hey, hello. I feel like I know a lot of people on this call, but if you don't know me, my name is Kate Gerard. I'm the state WIC director here in Montana, have been so for almost, well, state director for about 9 years here, almost 10. And just side note, my time at Montana WIC is coming to a close here pretty soon, and I'll be moving to the national office. So still definitely working in the WIC world and excited to see what all happens in the next few years. But a ton of really great work has been happening over the last couple of years, and I'm excited to see it all starting to really come to fruition. So you know, my vision, yeah, thank you. This is helpful because this is my vision for WIC right here. This slide is like my brain dumped into a slide. So a lot of great things have been happening. I feel like there's been a lot of great projects in the last couple of years, and with the innovation funds from ARPA and the direction our technology is going, and all kinds of other opportunities that are coming, like with the food package and potentially with CNR and waiver authority and things like that. All of this is sort of all coming together. And I think in the next, well, now and over the next few years, we're going to see a big transformation of the WIC program. We're just going to start doing business differently. We just are. COVID was horrible. Coming out of COVID, we're just going to have to do business differently. We're not going to go back to pre-COVID times. And so we can harness this opportunity to rethink how we deliver services and to meet people where we are. So we've been working, on a side note, we've been working with the Montana AAP, the American Academy of Pediatrics, on a project we're calling NAP, or Nutrition Access Project. This is a totally different project. We've just been working closely to see if we could sort of co-locate or really improve our referral systems with doctors' offices or clinical settings at a few local WIC clinics and really improve that referral system, right? We've also been working on this project with Nava for about 4 months or so now to build this online screener application. I use those words interchangeably. And that would be a really simple screener. It should only take a few moments. It's very similar to what USDA has, if you're familiar with that. Essentially, just someone could jump in and sort of see if they generally qualify with the high level items like income, categorical eligibility, where they live, that kind of thing. Kiddos under 5, that sort of thing. The difference really would be that it would end up in an extract of information for the state to close the loop on getting them enrolled. Whereas the USDA application, of course, is like, great, it sounds like you might qualify. Go ahead and call WIC, right? Which is a dead end. And so our idea was really to sort of take the next step from that screener and to turn that into a, well, who are these people? We would love to get them enrolled. Let's get them an appointment and get them certified, right? And then, so that's like a nice little step in the right direction. But of course, the bigger vision would be to enroll them, which is a lot more work. You all know that. So what you're seeing here is a slide that I thought would be handy to just give an overarching view of how I see this all flowing together. Because if you're like me at all, well, I'm very visual, but I also like to see how it all fits together, particularly with ARPA, because ARPA is about innovation, it's about modernization, it's about recruitment and retention. It's also about transforming the whole project or the whole program. So it's not just about technology. It's not just about getting numbers of people through the door. It's really about all of it, which is a lot to wrap our heads around, right? So what we have here is a little bit of a journey map. So I'm just going to quickly walk through it, and then we could just kind of run through our slides, talk about what we're building, and then see how this grant in particular fits with the project we're working on. But my goal also is for you to think about how the series of grants that are going to be coming out at you. Now you see how they're going to be coming, right? So we've gotten like 4 in a month. Big grants that we have very quick turnarounds on and not a lot of time to think about. So I have a feeling that's going to be the trend. We're going to keep getting, I don't know. I don't have inside intel on FNS yet, but my guess is we're going to keep having big grants coming at us really quickly. And FNS is going to be really encouraging us to be very innovative and to do a lot of great things with these grants. They're just going to be like, here you go. And then Congress is going to be like, yay, yay, WIC, like do great things. And we're all going to be like on the other end of the fire hose going, oh my God, we're under resourced, you know? And so what I really think we need to do is take a step back, zoom out a little bit, see the big picture, have a vision for what we want WIC to look like in the long run being the next 5 years, and then pieces of the puzzle that we want to improve and how those grants fit into it. So today is just one piece of that puzzle. Okay, I'm gonna keep talking. I was going to say I'm going to stop talking so much, but I'm not. I'm going to keep talking. Okay, so this is the journey map. The top row, or yeah, I guess you call that a row, is mom's journey having a baby. Some of us have had that journey. It's really fun. Bottom journey is the staff journey of interacting with mom. Here she's interacting with mom kind of while she's having the baby. Not our normal experience in WIC. So again, the green here is the nutrition access project we're talking about. And so in Bozeman, one of our clinics, what they're doing is they're actually going to the mother baby unit in a hospital to meet all new moms and babies, ideally. Sometimes they're in and out because they're really lucky and they have like a flawless birth. So they're in, have baby, boom, they're out. And sometimes we miss them. But generally, the idea is mom checks into the hospital, they hand them a big stack of paperwork, they fill out all the paperwork about themselves and ideal baby and birth certificate stuff, all these things. We've slipped a screener in there about with the standardized food security screening questions, the validated ones, there's only 2. And then a few checkbox questions on if they participate in WIC, Medicaid, SNAP, TANF, those kinds of things. And so they just fill that out along with all their other paperwork. The WIC staff, when they come in, so mom goes along, has her baby, she's in the room hanging out with baby. WIC staff come in, hopefully the next day or 2, mom's still hanging out. WIC gets to see that paperwork. It's in a little file for them. They get to see the mom. They're going to talk to all moms. This is universal screening, which is nice. You know, we're not trying to stigmatize anybody. We're not, calling anybody out. This is the health department walking in to say hi to every new mom and baby, congratulate them, provide them some basic information about the services available locally. If they seem to qualify for WIC or home visiting or other services, awesome. They're going to provide them an opportunity to start an application. So they're going to come in, they're going to have seen that paper and know if they're already on WIC or not, and if they flagged positive for food security. This is where the pink starts. This is where the technology we're building with Nava, and this is where my dream is. This isn't happening today. The mother baby piece is. Once we get this online application going and we have little tablets for the WIC staff to walk into the room with, that's where the dream happens. So the WIC staff are now going to have this nice little tablet. They're going to have this app that we're building with the online application. They'd walk over to mom, congratulations, beautiful baby, hold the baby, give mom the tablet. She's going to take like 5 or 10 minutes, fill out a quick application. Side note, what we want to do with this new technology grant, if possible, is build, we already have some funding for it, but build a fairly robust portal, like an actual portal for WIC. It's going to be integrated with the online application. So depending on how much money and time and resources we have, we'll scale the portal. Side note, I'll get back to that. So we hand mom the tablet. She fills out as much as she's comfortable with, and they can do in that few minutes. At that point, it could go a few different ways. Mom may have hit her wall with WIC. She might want to go back to sleep, whatever. They part ways. Maybe she schedules another appointment in the nice new portal. Maybe WIC says, great, I'll give you a call on Monday, whatever happens. But they're going to have started an application. They're going to have engaged. They've made a face-to-face. They've have multiple touch points then with WIC. We've streamlined enrollment. We're going to have a document uploader. They will have some medical documentation there. You know all the things. We're going to know if she's on Medicaid or not. We have physical presence, check, right? So you can envision the rest of the certification is going to be really easy. It could be telehealth. It could be a week later in the clinic, and we could just talk to her about breastfeeding and nutrition education and then just issuing the benefits. It could just be a portion of what it would otherwise be a week postpartum, and it wouldn't be that hour and a half of chaos. Next slide. So this is an overview of, again, just a colorful representation of sort of purple being the screener that I just mentioned, already in action, already being built. Again, purpose is really for the participant to use, very simple. And then also for providers, again, providers that we work with as in healthcare providers, it could be like a care coordinator, could be a Head Start, health manager, something like that. They may all have access to this online application and can start it. Again, the pink would be the participant portal. The online application is one funded project that Nava came to the table with. They had philanthropic funding from Schmidt Futures and came to us. We haven't paid anything. We agreed to work with them to help them build it. It really is for everybody in the WIC community. It's not just for Montana. It will be open source. Anybody can use it with any system. Now, we have also applied and received another bit of funding from Schmidt Futures to build the portal, which for us is an add-on. It's a separate project, but for us, it's a nice package with the application. And it's going to be a portal, again, philanthropically funded for a certain scope of it, document uploader included. It doesn't have all the bells and whistles I could dream of. That said, what great timing. We got approved for that funding. We're about to kick off that project, and boom, FNS puts out this beautiful ARPA funding for $350,000 per state with very little strings attached. My mind about explodes, because what could really, really happen right now is there's a whole lot of states out there that don't want to leave the money on the table, would love to grab the 350 and do something really fruitful with it to further WIC, don't have a lot of time and resources and would love to jump in on a project that's already going. They don't have to do procurement for, they don't have to add a lot of people and time and all the things for. That would benefit a lot of people. And here you go. So in my brain, what makes a whole lot of sense is that 3, 4, 5 states could take their $350,000, we as a collective could go in on the portal that's already being built with this much scope and just add some scope to it. It could happen faster. It could be bigger and more robust. And I will answer that question, Elizabeth Walsh, talking about Spirit Classic. It could be bigger, it could be better, it could be faster if more states go in on it. Regardless of if anybody goes in on it or not, we're building something. It will be open source. Anybody can take it. So the green box here is the API standard. I'm not an IT person, but I happen to know what an API is kind of. An API is something that's going to connect our MIS. So Spirit Classic, Desktop, Old Spirit, whatever you want to call it. I call it in hospice. I'm really bad. Anyway, there's all the other MISs out there. There's a lot of MISs in WIC, tons of MISs. And even if people have the same MIS, they might be hosting it differently, calling it something different. That's kind of a problem, in my opinion, for WIC, because that means that all of the other technology that comes along doesn't necessarily play well with others. So this is a great example. Good question. We build this portal, we build this online application, and then you have 15 states going, well, that's really cool, but I have this system over here that it's not going to talk to you. So the API standard is something we're working on, and it's going to be, the idea is for the API standard to connect, to have the ability to connect technologies like this portal and application to any MIS. So it wouldn't matter whether you have Spirit or 3 Sigma or Sequest or Mosaic or Mountain Plains or what, all the systems, Crossroads. In theory, it shouldn't matter. We all have a similar data set that we collect. We all have similar data elements that we collect. And so if we have that established, then in theory, the data streams from one technology to another, they should be able to plug and play. That's the extent of my IT knowledge. Someone way smarter than me can answer more questions about that. But all that to say is that it's not MIS dependent. So this is not a pitch for any just states that are on Spirit. That said, plus orange box being, there's that whole MIS thing. That's a whole nother story, but it is a story that we're all talking about. It is a story that's not funded by ARPA. We are all in this other bucket of trying to fix and upgrade MISs, and that's a whole different ball of wax, but it's also one that I think is important to keep on the slides, because what is available out there currently is some online applications and some portals, but they're very specific to those systems. So I know Mosaic is building an app and a portal. I know Mountain Plains is building an app portal. I know Sequest system, I don't remember what they call it, but the consortium there is building an app portal. The problem is it's not a problem, it's great for those states, but it's only for that MIS with that company. So you have to have that system to use it. This will be open source, and you could procure an IT contractor to host, maintain, operate, enhance, whatever you want to do with it. Or your IT, if you have really good IT in-house, by all means, they could take it and host it. Okay, sorry, next slide. I might be talking us out of time, huh? Okay. So this is Montana's roadmap. We started to develop a roadmap because, again, there's so much to think about with what we have. Yes, two-way messaging. Sorry, I get distracted by questions. The two-way messaging, that is something we have currently with our appointment reminders. We have a separate contract with Teletask to do our appointment reminders. And the idea in well, not just my brain, this isn't just me, but like if we did scheduling in a portal, of course you'd want appointment reminders in there, and texting two-way is like just part of that functionality now. Absolutely, I think that would be part of it. But again, that's not in scope with the current portal that we're building. So that would require, again, a few states coming together and saying, this is a priority for increasing the scope of the portal. So this roadmap, this is something I wanted to throw together so that I could translate what's in my head for my upper management and my IT, our IT people beyond and above me that don't really understand WIC, that don't really understand the future of our technology, don't really know what's going on with ARPA and where the funding is coming from and what the landscape of WIC technology looks like outside of our WIC state. Plus, because I'm leaving, I wanted to leave a footprint of where we were headed and where I think we need to head. So we put this together, and again, we have sort of a nice, pretty, like now, the eligibility screener. We are doing some testing with the sites that we're also working on the NAP with, the Nutrition Access Project, because that's a great partnership where we can't co-locate clinics because we don't have enough staff. We don't have big enough clinics. We're very rural. So we don't have enough staff to go around to have clinics all over the place. So a piece of technology in a clinic is much more feasible for us. So if we can have a tablet or a kiosk in a FQHC or in a Indian Health Service clinic or something like that, it's much more reasonable to have them there and have the online application there that somebody can assist them with. So what we're going to try to do is test this and roll it out, if possible, if we get approval, with those sites. And so that's why the green is there, that we're going to try to test it with our referral partners. Next would be, again, kind of a rollout implementation, if this is really feasible and we could take it to the end. And then, of course, building the portal. And you'll see down below, launching a participant advisory council. That's part of it. This is human-centered design, and we'll get back around to that because that's a big part of what Nava does. It's a big part of why we're building what we're building the way we are. It's also, as you could see in the grant opportunity, it's listed there, human-centered design. That's big. A lot of times, and we're guilty of it too, we sit on these calls with our contractors and we design technology between us at the state office and our technology people, and we just like build, test. And at what point does a participant or a local agency clinic staff sit and give you feedback? I mean, we involve our locals in some testing, but the design phase is often not where we involve people. And so it is really important to get that feedback and make sure it makes sense and that it's easy and that it's going to be usable. So that's what that's about. And then again, future, this is like sort of, you know, what could happen in the next year or two. I think we can go forward. Oh yeah, and the stars here are the grant opportunities. So again, this is ARPA with the technology grants that are now and due at the beginning of September, which is like 2 weeks away. And if we had, like I said, if we even had 3 or 4 states that were willing to check the box on 350, sign their name and put it in the pot. And by the way, I know that's not how grant funding works. I tend to be a fairly creative person with these things. I don't have a lot of days left with Montana WIC, but I am more than happy after this call, if I've intrigued you at all, to jump on a totally separate call with just WIC states who can brainstorm procurement or some kind of cooperative brainstorming, and we can think about how that would look for real, like in reality. So we don't have to dream about that today or commit to anything today. That's not what we're asking for. We just wanted to like pique your interest if you didn't already have that money committed to something and you don't want to leave it on the table and this sounds really cool, you may use it someday. There's an option here maybe to jump in on this and do it. I don't know if I'm missing anything with those stars. I think I said all of those things, right? Let me know if I missed anything. Yeah, again, I think a lot of this stuff would happen, but again, it could happen in parallel. It could happen it could happen kind of like all together and quicker if at least several of us came together and did it. I think if just like 1 or 2 states came together and did it, it could happen. It would just happen a little more stretched out over time. So that's just my thoughts. If we could get a few states together, we would be all right. Most of you have probably seen this grant. It's just a snapshot of it here, $350,000 each. Not competitive. If you've seen it, it's a 1-pager. It's about the easiest grant in the world to apply for. I haven't quite figured out. I know with all of these grants, there could be a multi-state group that goes in on it. I haven't quite figured out if that means, like, let's say, I don't think I can commit Montana to being the lead just because I'm not going to be here and I'd be committing someone behind me to a lot of work. But let's say I was the lead. I don't know if that means I would be going in on it and then y'all would be like, I'll take the money, but send it to Montana. They're the lead. Or if I would write in and say, yep, X, Y, and Z states are saying that they're going to give me their money, or I don't really know how that part works, but we could figure that out, obviously. Someone a level above us could tell us that. This is sort of quote from the grant, just again, going back to human-centered design, which is exactly what we're doing. This reduces the burden on WIC participants and staff and all the things. So it just really highlights that what we're happened to already be doing and was not in any way, shape, or form timed with this intentionally. Just happens to be really lucky timing. So that's why we wanted to throw this together really quickly in the last couple of weeks, because we thought, I bet there's a lot of states that are kind of in the same mindset of like, these grants are coming at us like wildfire, or, you know, and we know that not all the states are applying for all the grants, and it's really kind of a shame to leave some of this stuff on the table when there are great projects you could just check the box and get involved in. It might be a little bit more than that, but all right. That said, my last day at Montana is September 16th. Kevin Moore is already the lead on the Nava project. He's our vendor manager, and he's also quite likely going to be my acting until they have a replacement for my position. Also just very knowledgeable, has been around almost as long as I have, and our email addresses are there. I'm more than happy in the next couple of weeks to get a couple of conference calls on the calendar and just kind of like brainstorm what this could look like on an application, and maybe get a few interested states just, you know, gathered and organized around the ideas. So I'm just kind of volunteering to get this sort of kicked off, but just know there's no selling here. Don't think that this is like a sales pitch in any way, shape, or form. You know, once Nava develops this, you know, should they be developing this, they're coming to the table with a lot of money. And I don't know what it would look like to put money into it. That's something we have to figure out. But once they're done developing it, we get it because it's FNS money and it's open source, and then we host it however we want. So it's not going to be licensed. It's not like we're paying them a fee. They don't own it. We own it, and it can be used with any system. So just, you know, just to put that out there on the table, this isn't proprietary or anything like that. So let's see what these questions are, and we can open it up for conversation. Yeah, compatible with Spirit Classic. Probably two-way messaging. Yeah, so texting like photos and proofs. Yeah, the idea is absolutely security. I mean, that's going to be top of mind. Absolutely. No one will approach this without security top of mind, and proofs being a document uploader, picture, something of that sort. If it's on a tablet, I imagine, I'm just assuming this, Lauren, right? Like you could take a picture of a proof.
So what I'll say is this, you know, the functionality we're talking about in this participant portal is it hasn't been built yet. So what I'm sensing from the question, you know, oh, these are some requirements and some things that a software development team would have to think about when building a document uploader. I will say that in my past project, another project I worked on with a different state where we built an application for paid family and medical leave, there was a document upload feature that was built for that. And yes, people could take a photo with it on their phone. So that is possible functionality, but does that specific functionality exist exactly today? Not yet, no. But yeah, we are now in the open Q&A and open state collaboration to talk through these ideas and ask any questions you have of Kate or of NWA or of Nava. So maybe folks can come off mute, especially if you've got a question you've added in the chat or want to chime in.
Hey, this is Jace.
Sorry,
Hold on.
you want to go? Oh, thanks. This is Liz Walsh with Alaska. This looks wonderful. We need something like yesterday.
too.
So I'm just wondering if there is an option for us to keep some of the money to purchase an existing functionality, like we're just thinking Tiger Connect, it's on the NASPO list. And then have part of the money for your project.
I mean, I don't see why not. I don't see many restrictions in that funding opportunity where you can't parse it out to different projects. I don't see why not. I've never heard of Tiger Connect. I can't speak to the functionality there. To my knowledge, this doesn't exist already, except for, like I said, to specific systems. I certainly know that, you know, like many states, we have a hodgepodge of systems we've put together to kind of put this all together. And that's part of my, it's part of my, I don't know, anxiety. It bothers me. It bothers me that we have 4 different contracts for technology. I would love an all-in-one solution that just connected with Spirit and saved everybody time and actually appeared to make it look like we were in the 21st century to our participants, and made it easy for our partners to just refer and have people apply wherever families were. It would be super cool if it already existed. I doubt anybody's designed anything like this with participants at the table or with WIC in mind. They might have something that would work with WIC. Like at the NWA conference, you know, there were some like telehealth platforms, you know, that were there and things like that I had looked at. And I'm like, that's really cool. We could probably use that in WIC. Was it designed with WIC in mind? Probably not. So you still have like that manual data entry. You still have like things to figure out to sort of bridge the gaps. And it's another technology you're adding to your pot, which is always, oh, Jamie Bish, I wanted to answer your question because I think that's an interesting one. Doing an APD for this for the $1 million, if it ends up being more than $1 million, that's the kind of stuff we have to brainstorm. If I recall correctly, and I could be wrong, I only briefly read that memo because quite frankly, I'm never going to write an APD again. But sorry, not sorry. But I thought I saw that it was just for MISs and EBT systems. I didn't think it was for an ancillary technology outside of those. Then again, I avoid the handbook 901 like the plague.
I'm not familiar with APDs either, but our regional person, Julie, called us just wanting to touch base with us about what our plans were. And she mentioned that if we combined resources, that would be something we would have to consider. So I don't know.
We should look at it. We should look at it. I feel like this is something, yeah, we could look at it.
Yeah, and I was gonna say, Kate, I do not believe that it is limited to EBT MIS. They had language in there that had some special notes for projects that were around EBT MIS, but it does not explicitly say in there that it has to be that. So, and I did want to answer somebody, or Kate, maybe I was going to say somebody asked, but I think it was you wondering like the fiscal sort of who would be I think the lead in a collaborative application, the lead state agency would be responsible for the funds. So the funds would flow through the lead state agency to whatever other states were in the consortium.
Oh, Kate, are you talking? You might be on mute again. Happy to facilitate to the next question. Okay, go ahead.
I'm sorry, I'm totally talking on mute. I was saying I'm looking for the memo, but we can keep talking.
Okay, great. Yeah, well, I'm happy to move us to Chris Haar's question that there are some participant portals that already exist. Some of these portals have functionality that we're talking about. Are we considering using or enhancing an existing portal? So is that question for Montana or for Nava or?
I can just jump in to say that I do think that that is a really interesting question. And in terms of like using an existing portal, I do know that like, I think it depends on where you're at with your own portal. So, you know, Oh, sorry, I'm hearing an echo back. It's just distracting. So I think it depends if you have a portal that you really like, that you want to like extend or add on to, like, of course, that's a really like efficient use of expanding it. But Kate, I'll let you kind of answer if you're considering using or enhancing an existing portal.
We're talking about with Nava? Is that? Oh, sorry, Chris, go ahead.
Oh, sorry, I have a little bit of a cold.
Oh, that sounds awful.
And we're making you jump off
Yeah.
mute to clarify your
That's
question. That's
okay.
very rude of us.
That's okay. Yeah, I was just wondering, this was for Montana, wondering because there are participant portals that exist that have document upload features that have they import the PDFs or whatever type document types into the MIS. They allow remote certifications, and I was just wondering if the funding was available for using for enhancing existing portals or taking existing portals and creating the interface with a different the new state MIS or a different state MIS, because all portals really could be modified to work with any MIS, and like you said, using the API or whatever type of interface. And I was just wondering if this funding was available for the existing portals, and if Montana or even Alaska would be considering something like that.
To my knowledge, I haven't seen any of the portals, and maybe some other folks on the line could jump in. I know like with Texas, they're building something with an app for Mosaic, and right now it's only available for Mosaic in the app. I don't think they're releasing it for anybody else to use at this point, but maybe eventually. I know Sequest is building one. I know Mountain Plains is building one. I haven't seen them yet. I don't know of any that are like done and able to demo and potentially use. Actually, 3 Sigma, I guess South Dakota has one. They've done with 3 Sigma.
New Jersey has one. New Jersey's using one right now.
And I guess what company? Like, I have no idea.
CMA Consulting.
I haven't considered it. I haven't looked at it at all. It would need to be considered. And is it proprietary? Is it licensed? Is it open source?
It's
I don't know.
USDA funding, so it would be open source. Yeah.
Yeah, I've never considered it. I mean, we never have had, the funding or the project resources to build or adapt something. And so again, Nava coming to the table with a project that's already funded and ready to build.
It just seems like a lot of work to create a new system as opposed to taking an existing system and making modifications or enhancements for what you need.
It depends. I mean, I'm coming from my technology background to Spirit, and that's 20 years old, and we are re-engineering it because nobody wanted to rebuild it. And I would strongly disagree with that statement because it is a rat's nest and it's years behind schedule and many millions of dollars more than we anticipated. And it's not all getting done and all the things.
Well, it's
So
a
sometimes
participant portal. It's not Spirit. It's a
I
participant
know.
portal.
I wonder if, when it was built, how it was built, the platform, how easy it is to enhance. I know that like with a lot of states, sometimes when we talk about MISs, there are states who are very, very happy with their MIS, but don't want to, it's very unique to the state. I guess I would say there's a lot of states who have their own technology built the way they want it because that's the way they want it. And so it would take quite a bit to unravel that and build it the way you want it. So I don't know. I haven't explored that.
Yeah, I think there was a demonstration done of the New Jersey participant portal at the last NWA conference, but it would be good if we had a forum to look at the existing portals and see what's available.
Yeah, thanks for sharing that, Chris.
Yep, thanks.
It's sort of directed at Kate in Montana, but really at any rural state. All these systems are very predicated on access to bandwidth and access to technology. And I'm wondering like what kind of, I'm newish. So I don't know, like maybe you've already done a needs assessment to know that this technology in this form can actually work for participants. But I'm wondering how that like factors into this project and factors into these technology monies, because they really are predicated on everybody having a smartphone and everyone being able to use it. So I'm curious about your thoughts about that. And anybody else's too. Sorry, I was didn't mean to be so pointed at you.
No, it's fine, because I mean, Montana is not quite like Alaska, but we're not that different, and that we're really rural, not as rural, but we do have a lot of dead zones in terms of connectivity. And I would say, in terms of like when we went to EBT, we did do an assessment of how many people had smartphones, because we wanted to estimate like how worth it would be to go to WIC Shopper, and like, should we even be printing participant booklets anymore, and should we really push electronic everything, or printing, paper, and so those are the kinds of things you have to think about. Is everybody online, or can they do online education, or do we really have to be in person doing everything in paper manually? And I think it's always going to be a hybrid, and it's going to be more hybrid, or more both options for us than it is going to be for some of the more densely populated states. I would say at least 80-85% of the people in Montana do have smartphones and do use the technology available to them. Even if they have WIC Shopper, can they use it in every single store all the time? Probably not, but they're using it most of the time. They also have the option to have a pamphlet in their hand. As far as having something like this, it wouldn't replace what's existing now. It would supplement it. I actually see it as an enhancement, because let's say in the southeast corner of our state, we have this county called Carter County. There's the cutest little town called Ekalaka. There's a teeny tiny little health department. There's about 10 families who could qualify for WIC and aren't on WIC because it's hours drive. And the cutest little health nurses there call me about once a year and desperately want a WIC clinic, but can't get anybody to drive out there. And it's just this ongoing conversation. And about a year or two ago, the little tiny store there got on WIC, and we were like, sweet, now they have a store. They don't have a WIC clinic. There's these 10 families who really want WIC. What do we do? And yeah, maybe those families have access to technology, maybe they don't, but guess what could happen? Those nurses could have a kiosk and in the health department, and those families can come to the health department and they can weigh and measure, get them on the little kiosk. They can do their online application. Maybe the nurses are CPAs, maybe they're not. But even if they could do half of the appointment there and have someone call them over the phone from another clinic and do the education and issue benefits remotely, that's increased access. That's like better access than they have had to date. So I think I envision, so getting back to the first slide, I envision a world where we can't have clinics in every town and every place. It's just not feasible for us. But I would like a point of access wherever our families are. If it's the delivery, maybe not the delivery room, but maybe the recovery room, and like Head Start, or like, care coordinators talking to families, or social workers, or home visitors, or, whoever is serving our family. Why not give them a little tablet, have an MOU with them that has some agreement? Maybe they do a civil rights training, some basic eligibility training. They are tuning into a family potentially being eligible, hand them the little tablet, fill out this application, WIC finishes it on the back end. Boom, increased access. And you guys are lucky because you could ship them a box. That's awesome. I want to get that system in place. Like nice little
Well,
box of food.
that system also is part of the question, right? Which is because it is a great system and it seems like the answer. But when you look at the research, when we look at how much it's utilized, it hasn't been a silver bullet. And so understanding, is it technology? What is the speed bump to getting people in? And so that's why I asked about the needs assessment part. Thank you for your thoughts.
And a quick question, it's not a needs assessment for this project, but we did publish a needs assessment. We have one on our website, and we just published in our state, well, we haven't posted it yet, but we have a strategic plan that has all of our goals and objectives and metrics around all of these projects. That's going to be section 1 of our state plan this year.
Yeah, and I think another plug for human-centered design is that those types of questions about the online and offline experience are fair game when we're doing research with human-centered design. We're not always just focused on the technology and its requirements, but we're focused on people's experience around the technology and making sure it fits into folks' workflows. For example, with the screener project we're working on with Montana right now, it will spit out a CSV or a report of some kind, and we need to make sure that that fits with WIC clinic staff workflows and doesn't add burden. And so that is part of our research, that is part of our testing. And it can be part of other human-centered design projects and technology projects you do as well. Well, we've had some rich discussion, some great questions here. Thank you for folks who've submitted them and asked. What other questions or collaborations could we foster in the remaining 10 minutes here? Any other ideas states have had for this funding already? Any other projects you've been thinking about or hoping for?
Just gonna be honest, I'm reading this memo. I don't see anything outside the EBT or MIS. They say it over and over and over. MIS, EBT, MIS, EBT. I'm hoping that's consistent. My new job will be in policy to interpret these things. So.
Yeah,
I'm
and
really
I didn't mean, they do like repeat that over and over. I just meant like, I didn't see anything there that
Yeah.
explicitly said it couldn't be that, but that is what they sort of reference throughout.
Mhm. It's a good question to ask. I mean, it refers back to Handbook 901, which there's a whole chart of thresholds and projects. I've only ever used those documents with MIS and EBT. I've never contemplated using them, although they're not generally high ticket items for other technology. Unless you're developing something really big, it doesn't usually get to those thresholds, but I could come through that 901 one more time. I probably will do that in my new job too.
So I'll try maybe posing that question one more time to see if anybody has any other ideas. So when this grant came out, were there other projects that you states were thinking about using it for? I thank you, Alaska, for sharing one of your ideas. Just thinking states can learn from each other if we share what some of those ideas you all had were. So anybody else thinking about applying for this and want to share what they're thinking about?
This is Kathleen from Oregon WIC. I think that it was a really nice surprise to see. Ever since the ARPA, funding was announced a couple of years ago, I was curious how it was going to be administered, and I appreciate how few strings attached are, and it's this resource. For us, I hate to speak for all of Oregon WIC, but one of the pieces of excitement for me seeing it is that it gives us some resources to be able to kind of coordinate efforts that we've got going in a number of different areas. Because I think every state program probably recognizes that technology is moving forward, and I think COVID pressed us harder to think and move to that space. And so I think it gives us a little opportunity, because there's always staff and time that gets to be a constraint as you try to innovate. And so for me, it's pretty exciting because it gives us a little breathing space for the things that we've already got in the hopper and in development to kind of build in a little more time to devote to moving those projects forward.
Yeah, great. Also very cool to hear that you've got quite a few projects in motion. So thank you for sharing. I'm seeing in the chat Angela sharing that some states are using the funding to move from smart card EBT to online EBT and to enhance the portals being built. Cool.
Well, I'm going to speak to that real quick because that was part of the reason we had a call with our SNS regional person. They are not allowing you to go from smart card to online function. So that's absolutely not going to be allowed. But from my biggest perspective, because the thing that I really told Kate that interested me about this, other than, you know, all the benefits of it, and that our agencies really have been asking for something like this, is we have very limited resources here. So my big concern right now with Kate leaving is, you know, is anybody interested in taking lead? And I just curious if anybody would be willing to speak up to that. I can tell you from Missouri's perspective, we don't have the staff to do so. We've got almost too much on our plate right now. We thought about, you know, honestly, I felt like we had division telling us not to accept the grant funding, but we kind of got told by FNS, no, we want you to take this on. So a little bit different perspective from Missouri side of things.
Interesting.
So
Thanks for sharing that.
Mm-hmm.
Can you use it to capacity build and say hire in a project manager to you know, oversee that 2-year time period of a way to use the funding? Because it didn't look to me like it had restrictions, you know, like for salary or hiring.
Yeah, you can definitely use it for that. I know right now we're waiting to hear who's going to take lead for this project, but we do have a plan B for Missouri. It's not as exciting as this, but you know, a lot of states have some very interesting dashboards, data dashboards on their web pages, and Missouri is behind on that because we haven't had the staff to, you know, get familiar with some of the new things like Tableau. And so we are looking to contract somebody out to do that for us as our plan B. But again, we'd really love to see this go forward.
I was wondering if maybe you would want to send out, you know, I'm talking about LP and Kate, an email to that, I think it's 96 or whatever, you know, kind of saying if you don't have ideas that are prominent in your mind, would you be interested in exploring this option? Because you might, this office hours might have drawn some of us who have a number of things in mind. Not that, I don't know, I'm just thinking there might be some that are really at their wits' end about, you know, we have nothing we want to, that we have the ability to jump onto right now.
And I can't say for sure that Montana wouldn't take the lead. I mean, certainly if I was sticking around, I would. And I'm gonna, you know, again, talk to my leadership about these options and the roadmap and everything. And we're already working with Nava on a number of on projects. So it could be that if they are, you know, bought in with this and okay to, you know, really dig in with Nava, and it's just a matter of saying, hey, a few states would be willing to contribute XYZ funding. You know, if they're already in it and taking the lead on it with the projects we're already on, I mean, maybe Montana would take the lead, you know, and figure that out. I don't know. It would just have to be somebody beyond me. So, so Kevin doesn't have to jump at the opportunity today on the call, but there would have to be, you know, internally somebody would have to. And yeah, you're right, in the sense that, like, for anybody who's thinking about resources in terms of people doing it, that's true. It is, I'll just speak from a state perspective, it is hard to conjure up humans on state. Creating FTE is not easy, and like I know in our state, IT project management is really scarce, really scarce. We're not competitive. It's really an independent world out there that's we'd have to contract out for, so we'd have to like procure that, and that would take 6 months. So that's like 6 months of the 2 years. They'd have to learn the project, and then there you are. So
Well, I want to say thank you to everybody who joined us today, who were enticed by the Montana vision. ask questions, listen to questions and answers. It was great to see all of you here. I'm glad we got to jump on this opportunity and spin this office hours up pretty quickly. I'm recording the session and I'll work with my comms folks on what happens next. And please do email Kate and/or Kevin if you are interested for next steps that will be going through them. And finally, I just want to plug that on September 8th, we have our demonstration project update demo day, where we'll be sharing our progress since our last demo day, which was in July. And at the end of our project in early November, we will share our outcomes and reflections. So stay tuned for more on the demo project. And yeah, I hope you have a wonderful rest of your day. Thanks again for joining, and we'll see you later.
Thanks, everyone.
Thank you.